So we've gone through oligodendrocyte proliferation, remyelination, neuroinflammation, and neuroprotection. Now we're going to talk about axonal regeneration. Because we do have axonal degeneration, it gets damaged when the myelin sheath is completely gone and the immune system starts attacking the axon. So unlike axons in the peripheral nervous system, central nervous system axons do not readily regenerate. It's a lot harder for them to regenerate. And axonal loss is well documented in the CNS of MS patients. So to date, there has been no research done to explore the interactions between exercise and axonal regeneration in both human and mouse models. So this shows that there's a very big need for research in this area of axonal regeneration. So what the authors go and do, and they bring examples from spinal cord injury patients and peripheral nerve injury, spinal cord injury models and peripheral nerve injury models. I'm going to focus more on the spinal cord injury models because that's still part of the central nervous system, and we can relate that more closely than using peripheral nervous system examples. So there's a study here in 2012 showed prior exercise in mice had been shown to have a protective effect on the brain and spinal cord by reducing the decreases in BDNF and synapsin 1 brought on spinal cord injury. So in spinal cord injury, once you have a spinal cord injury, there's a decrease in BDNF expression and synapsin 1. Synapsin 1 is a protein that plays a role in the regulation of axonogenesis and synaptogenesis. Axonogenesis is the recreation of new axons, and synaptogenesis is the increasing of sprouting of the communication zone of the axons, so you have more synapses and better communication. Why is that important? I know we're talking about spinal cord injury in this article, but the same thing happens in MS patients. So this is also really important. There's a molecule, a proteoglycan called chondroitin sulfate proteoglycans, CSPGs, and this type of extracellular matrix is found in glial scars. Now this molecule actually inhibits axonal regeneration and remyelination. So there've been therapies targeting these CSPGs with drugs that are anti-CSPGs, and combining this with exercise and seeing what effect it has. And they found that there's a synergistic effect of combining exercise with anti-CSPGs. So they give an example here from a study. Rats with cervical spinal cord injuries regained manual dexterity after treatment with chondroitase ABC, which removes the CSPGs, and voluntary forepaw motor rehabilitation, but neither treatment alone had an effect. Wow. So we know that CSPGs inhibit, which are found in glial scar tissues, inhibit axonal regeneration and remyelination. So we have anti-CSPGs, big word, anti-CSPG drugs combined with exercise in cervical spinal cord injury mouse improved the manual dexterity and voluntary forepaw motor rehabilitation. However, both of them alone did not have any effect. So this relates to MS patients because we can extrapolate that to MS and say that exercise may have a role in axonal regeneration there. So there's not much study being done in that part in MS patients, so I'm just going to leave you with that one study. Further research needs to be done there, but there is some evidence to suggest in animal models of spinal cord injury patients that exercise improves axonal regeneration and synaptogenesis and remyelination.